Further remarks, the good member from the 19th District, Representative Walsh.
Thank you, Mr. Speaker. Do not concur. As much as it pains me to disagree with the good woman from the 49th, the busybodies across the way insinuated themselves into the public policy and made it worse. Of particular note, Mr. Speaker, their changes waive the fee that government entities that may be operating healthcare facilities have to pay to the State Attorney General's office when they submit the paperwork related to a substantive change. That's the term of art in this area of policy. When there's a material change to the ownership of a healthcare facility, often a hospital, but not always, there is a bureaucratic form that the organizations owning the facility need to submit to the Attorney General. So the change is that while private sector organizations have to pay a fee to submit the paperwork, now government organizations that have to submit the same paperwork don't have to pay the fee. Well, that's not fair, Mr. Speaker. And I'm surprised the Attorney General is going for it because it cuts the amount of fee revenue they get. Not a good improvement to an already troubled underlying policy. Do not concur.
The good member from the 19th District, Representative Walsh.
Thank you, Mr. Speaker. Bad bill, vote no. If I were looking for a nice thing to say about it, Mr. Speaker, I would say, well, it's slightly less bad than other versions of the same policy we've seen. Mr. Speaker, there is a fundamental fallacy underlying this policy point. The idea that if we add more regulatory red tape and mumbo-jumbo to regular transactions in the healthcare space, somehow that's going to make the delivery of healthcare more efficient or more effective or easier for people to receive. And Mr. Speaker, there's just no evidence of this either practically or ideologically. Mr. Speaker, we can agree that we need to do a better job of delivering healthcare services to people in this state. Agreed. This proposal doesn't do anything to make the delivery of healthcare services cheaper or more available or easier or anything. Now, this affects primarily hospitals, but it can affect other facilities that aren't hospitals. Your kind of outpatient clinic or specified kidney dialysis centers or things like that. Now, the focus, of course, is on hospitals, and there's a lot of rhetoric around hospitals and their ownership structures and their finances. But at the end of the day, Mr. Speaker, the changes we need to make healthcare more available and more affordable for people are not this kind of change. Adding levels of regulatory bureaucracy to an already over-regulated and poorly regulated marketplace doesn't fix the problem. Please vote no.